Are you gonna eat that? A presentation on placental consumption and protocols, presented by Amy.
And Kendrick.
So, what is the placenta? The placenta is a temporary organ. It doesn't start developing until 3 weeks into embryonic development. Around this time, the placenta develops on the uterine wall where the embryo attached. It's also a two-sided organ. There is a maternal side and a fetal side to the placenta. The maternal side consists of the vessels for circulation. When evacuated, it is the side that looks like flesh. The fetal side consists of villi and the three vessels in the umbilical cord that provide blood and nutrients to the fetus. The placenta is the only provider of blood and nutrients to the growing fetus, so it's very important. Anatomy and physiology of the placenta. There are three main layers of the placenta: the outer layer, the middle layer, and the inner layer. The outer layer is called the decuta basalis. This is the layer on the maternal side of the placenta. It consists of the maternal vessels and is the bulk of the placenta. The middle layer is called the chorion. This layer consists of chorionic villi that nestle into the decuta basalis. This is the functional layer of the placenta. This layer is where hormones are secreted and permeability takes place. The inner layer is called the amnion. This layer consists of the amniotic sac, amniotic fluid, and the fetus. Functions of the placenta. Placenta participates in metabolic activity, transport function, endocrine function, and it has immunologic properties. Metabolic activities consist of storing glycogen and iron. The placenta also produces glycogen, cholesterol, fatty acids, enzymes, and it breaks down epinephrine and histamine. Transport functions are what set the placenta's permeability. Substances are passed from mother to fetus by simple diffusion, facilitated transport, and active transport. The hormones that are secreted during pregnancy are essential for keeping the fetus viable. The placenta secretes human chorionic gonadotropin, which is HCG, human placental lactogen, which is HPL, relaxin, inhibin, estrogen, and progesterone. HCG is crucial for maintaining pregnancy after fertilization. When the egg is first fertilized, HCG keeps the corpus luteum functioning in order to maintain levels of progesterone and estrogen. After the 11th week of pregnancy, the placenta is able to maintain the levels of progesterone and estrogen independently. Immunologically, the placenta is in a class of its own. The immune system usually always has a reaction to any foreign body. But with pregnancy and the fertilization of an egg, the body does not attack the egg when it is attached to the uterine wall. It is believed that when the villi nestle into the uterine lining, they send a signal that does not alert the sensitive T cells. Pretty amazing, right?
Let's talk about the benefits of ingesting the placenta. The placenta is shown to increase milk supply, balance hormones, wards off postpartum depression, replenishes depleted iron due to blood loss, increases energy level, reduces postnatal bleeding, speeds up recovery time, and assists uterus to return to pre-pregnancy state. According to MayoClinic.org, mothers who consumed the placenta postpartum showed an increase in prolactin hormone, which increases lactation, and those by increasing milk production. In addition, the evidence was recorded using 2,000 mothers who consumed the placenta postpartum, but only 130 mothers showed the increase of prolactin. More evidence is being collected to verify the benefits of ingesting the placenta. In addition, while some medical professionals may claim that consuming the placenta can prevent postpartum depression, reduce postpartum bleeding, improve mood, energy and milk supply, and provide important micronutrients such as iron, there is no evidence that eating the placenta provides health benefits for the mother or for the newborn child.
If a mother does want to take her placenta home, here's a picture of what a medical release form would look like. On this release, it shows the infection risks, how to handle the placenta, and it also makes a public health announcement.
As we just discussed the benefits of ingesting the placenta, let's transition and talk about the risks of ingesting the placenta. So, what are some risks of ingesting the placenta? Well, the placenta could be contaminated. As mentioned before, one of the main purposes of the placenta is to filter out toxins from harming the fetus during utero. In addition, some of those toxins may remain instilled in the organ, having potential to cause illness to both the mother and the child if breastfed, and to any other family member who consumes the placenta. The placenta is an ideal host for bacteria and pathogens. During childbirth, even if the healthcare providers are aware and cautious about germ contamination, the guarantee for the placenta to remain clean is unguaranteed. In addition, during childbirth, there are many different body fluids which could contaminate the placenta with bacteria and pathogens. Maintaining the placenta safe for ingestion is your responsibility. If the patient is considering to take the placenta home, the patient is responsible to ensure the organ remains viable and within temperature regulations. Like any ingestible meat, the temperature must remain adequate so that the tissue does not reach danger zones for bacteria and pathogens to grow. The healthcare team is not responsible for the organ once the recipient signs the release for responsibility consent form. It is suggested that the recipient of the placenta brings a cooler with ice to maintain adequate temperature, and that someone takes the placenta home within 1 to 2 hours after delivery and place it in the freezer or the refrigerator until it's ready to be consumed. Another downfall of ingesting the placenta is that there is a high possibility of not obtaining the expected benefits. Not everyone who consumes or ingests the placenta will experience the benefits of the placenta once ingested. A high risk of ingesting the placenta is the possibility to spread illness to others. Although you are consuming your own bodily fluids, some cultures share their cooked or capsulated placenta with friends or families, increasing the risk of causing harm to those who consume it. Even if the placenta is cooked well, many body fluids may still be transmitted to others and cause blood-borne pathogens and severe illness. Disposal of the placenta is your responsibility. The placenta is an organ that contains body fluids and is considered biohazardous waste and must be disposed of correctly. Some recipients that take the placenta home may change their mind about consuming it, and that is okay, but the recipient is still responsible to dispose of the organ properly. According to a local hospital, Desert Regional Medical Center's protocol, the only two methods of discarding the placenta is by interment, which is burial, or incineration, burning the placenta. Now that we covered what are the risks of ingesting the placenta, let's discuss what will prevent the recipient from taking the placenta home. Hospital policy. Some hospitals do not allow patients to take the placenta home due to protocol or hospital policy. Many hospitals consider the placenta an organ and will not allow it to leave the hospital. If the patient plans to take the placenta home, the patient must do their own research on their local hospital protocols to ensure the hospital allows the patient to claim the placenta postpartum. Group B streptococcus, or GBS, is something that will prevent the recipient from obtaining the placenta postpartum. According to American Pregnancy Association, GBS, or Group B streptococcus, is a type of bacterial infection that can be found in a pregnant woman's vagina or rectum. This bacteria is normally found in the vagina or the rectum of about 25% of all healthy adult women. Women who test positive for GBS are said to be colonized. A mother can pass GBS to her baby during delivery and postpartum via breast milk if the mother consumes the placenta that is infected with GBS. If the mother tests positive for GBS, the placenta cannot be obtained postpartum. Hospitals usually send any infectious or damaged placenta to pathology. HIV and other sexually transmitted diseases. Any blood-borne disease automatically disqualifies the patient from obtaining the placenta postpartum due to a high possibility of infecting others if consumed or touched. Placenta infarcts. A placenta infarction results from the interruption of blood supply to a part of the placenta, causing its cells to die. According to MayoClinic.org, small placental infarcts, especially at the edge of the placental disc, are considered to be normal at term. Large placental infarcts are associated with vascular abnormalities as seen in hypertension. Very large infarcts lead to placental insufficiency and may result in fetal death. Due to a lack of oxygen supply, some of these tissues may be dead and cause harm to anyone who consumes the placenta. In this case, the placenta is kept in the facility and sent to pathology. Drug-related deliveries. Drug-related deliveries will automatically disqualify the recipient from obtaining the placenta and possibly the newborn. Most hospitals will do a pathology report on the placenta and a umbilical cord study. Social services will be involved to protect the newborn. Most hospitals will obtain a drug screen of all the mothers in the delivery ward prior to delivery to ensure the safety of the newborn. Important disclaimer. Consuming the cooked or encapsulated placenta can be harmful to you and your baby and to anyone else who consumes it. If you are looking for ways to promote your health postpartum, it is always recommended to talk to your healthcare provider about proven alternatives rather than self-research.
So, what are the responsibilities of the nurse? Well, the nurse needs to verify hospital protocol for releasing human organs. Some institutions don't allow this at all. Verify that the placenta is healthy and the patient is able to take it home. If the mother is GBS positive, HIV positive, STD positive, or was positive for any drugs, the nurse needs to educate the mother why it is unsafe to ingest the placenta. If the placenta has any abnormal characteristics, the nurse needs to make sure that it is sent to pathology and not disposed of. If the placenta does pass all the above assessments, the nurse will need to verify that the release of responsibility form is signed by the patient. Once that is done, the nurse can go ahead and give the patient the placenta, and it is now their responsibility. We hope you enjoyed our presentation.
Yeah, we braved an earthquake for you.